Hello, my name is Leah Gunn Barrett. I've lived in the UK for more than 21 years, the last 7 of which have been spent here in Scotland. I'm a dual citizen, American, UK, and I have a blog called Dear Scotland, which has been running for about a year now, where I write about why I think Scotland should be an independent country once again, why independence would make its people healthier, happier, and more prosperous. I'm taking from that blog 3 recent posts that I wrote, and they all have in common the theme of public versus private ownership of what could be deemed public goods. A public good is something like healthcare, water, education. And should these be owned publicly for the public good or be farmed out to private companies for profit? So the first piece that I did, how public is Scotland's water? Now, Thames Water, many of you have heard of, is in dire straits. It's literally drowning in its own sewage, and its customers are being forced to drink and bathe in it. But I noticed that its CEO, a guy by the name of Chris Weston, who was hired just back in January to turn the failing company around, was awarded a £195,000 3-month bonus, swelling his pay to £437,000 per year. Now, Scottish Water, which is publicly owned, also has a chief executive, a guy by the name of Alex Plant. And his total pay pack is £295,000 a year, which still sounds like a lot. However, it's a lot less than chief executives of water companies down in England. You probably thought, as I once did, that all of Scotland's water is publicly owned, but you would be wrong. It's true that in 1994, the Strathclyde Regional Council organized a public referendum and asking the people whether they thought London's idea to privatize Scotland's water, like they did England's, was a good idea. And a lot of voters turned out, 3/4 of the electorate turned out to vote, and 97% of those said, no, we want to keep Scotland's water public. So it's remained public, but that's only domestic water, the water that you and I have when we turn on our taps at home. Business water, commercial water, is another story. That's because before the last English Labour government at Holyrood was booted from office in 2007, as they left, they half privatized Scotland's water, the commercial bit. And they created a company called Business Stream Limited, based in Dunfermline. Now this sells to the non-domestic, the commercial market, all over the UK. On its homepage, Business Stream announced that wholesale water prices in England for 2025-26 would be rising substantially over the previous few years. Now, commercial water prices in Scotland last year rose about 8.8%. It's comparable to price increases down in England. Business Stream Scotland's 2023 operating profit was £17.2 million. That was up nearly 18% on the previous year. I couldn't find the compensation package for Business Stream Scotland's chief executive officer, but a Herald report from 2014, that's 10 years ago, revealed that the remuneration of their top executive was then £242,000, £242,800 actually. And so no doubt that after 10 years has increased substantially. I'd be surprised if it hadn't. And I'm guessing that the current CEO, a woman named Johanna Dow, that her package will be well above that of Alex Plant, the Scottish Water CEO. Nor could I find out what proportion of Business Stream's profits they're actually reinvesting into the business as opposed to giving out to shareholders in dividends or giving company directors big bonuses. In 2024, Scottish Water also raised prices to domestic customers by 8.8%. But, and this is important, it invested £1.02 billion to upgrade and replace water and wastewater systems across Scotland. It spends £72 more per customer than the private companies in England do. And if English water companies invested at the same rate as Scottish Water, they would have spent an additional £28 billion on infrastructure to fix leaks and to reduce the amount of sewage that they dump into waterways. Since 1990, private English water companies have paid, get this, £52 billion in dividends to shareholders. That each year is over £1.5 billion. That's money that should have been reinvested into making the system better for consumers. As a result of Scotland's publicly owned domestic water company, Scottish Water, our bills are lower and our rivers and seas are far cleaner. And I think everyone would agree that the quality of Scottish drinking water is extremely high. Now, only 14% of English rivers are considered to be ecologically sound. The figure in Scotland, 87%. Now, if Labour were to form the next right-wing Britnat government in Holyrood in 2026, I think they would be sorely tempted to finish the job and privatise the rest of Scotland's water, despite the complete catastrophe that private water has wrought in England. And we know that English Labour's Scottish supervisor, Anna Sarwar, will be doing whatever his English bosses tell him to do. Now I'm going to turn to another public good, which is healthcare, and whether that should be provided by private for-profit companies or by the public sector. I've titled this one, An Assassination in New York. When I heard that Brian Thompson, the chief executive officer of U.S. healthcare giant United Healthcare, had been gunned down on 4th of December in broad daylight in Manhattan, my first thought was a disgruntled person had taken the law into their own hands after being denied health coverage for themselves or for a family member. People in the UK can't possibly know what it's like to live under the American healthcare system, as it's called. There is no National Health Service, but it's a complicated network of private insurance companies that are solely motivated to make as much money as possible, not to improve the nation's health. Even the government-funded Medicare program, which was established by President Johnson in 1965 for Americans over the age of 65, has been hollowed out. It's divided confusingly into 4 different parts with costs associated with each part. Part A is for hospital coverage. Part B is medical coverage. Part C is private insurance for health and drug coverage. And Part D is just drug coverage. Now, you're probably wondering why there is private coverage at all in a supposedly public program for seniors in the United States. Well, that's because under President Clinton in 1997, he decided to give, and Congress decided to give private healthcare companies a slice of the Medicare business, which is quite lucrative for them. So in essence, you pay more for less, and you're paying it to a private company. It also used to be that seniors would have to pay up to £6,000 a year, or dollars a year, excuse me, in prescription drug costs before catastrophic drug coverage would kick in. But they did lower that to $2,000 a year maximum that seniors pay. And that was a bill that Congress passed in 2021. But imagine, in Scotland, you don't pay anything for prescription drugs. You do pay something in England, but it's not going to be as much as $2,000 a year. Or maybe it is in England, depending on the health conditions that you might have. I should also mention under the American healthcare system, under Medicare, which is supposed to be free, it does not cover dental, hearing, or vision. Now, among developed nations, the United States spends the most on health, surprisingly, but guess what? It has the worst outcomes. Americans die on average 4 years earlier than their counterparts in other developed countries. The U.S. is the only high-income country that does not guarantee health care to its citizens. And life expectancy at birth is 3 years lower than the OECD average. Not surprisingly, healthcare costs are the number one cause of personal bankruptcy for American families. Even if you have health insurance, that's no guarantee that you will not go bankrupt. Many policies will not cover certain conditions. You have out-of-pocket expenses. And in the case of big companies like United Healthcare, they routinely deny coverage for very expensive conditions. Now, in 2010, under President Obama, Congress passed something called the Affordable Care Act. And what that did is it mandated that people must purchase private health insurance from private companies or pay a fine. There's no public option in the Affordable Care Act. So this was a bonanza for private companies like United Healthcare. And it's the largest of the U.S. private healthcare companies. And guess what? United Healthcare has been operating in the United Kingdom. It ran primary GP services in England until 2011, but withdrew when things were not going terribly well. But then it came back in, it rebranded and refocused its efforts on patient data, on the patient data market, and created a company called Optum, which calls itself a health services and innovation company. In June of 2022, Optum bought a UK company specializing in patient data called EMIS, and it has a major share of the electronic patient market in the UK, also for pharmacies. Now, making patient data, which you think should be private between yourself and your doctor, making it available to private companies who are then going to profit from it, is, in my view, another step towards full National Health Service privatization. Now, that's long been a Tory goal, but unfortunately it also appears to be a new Labour goal. Now, there are links between United Healthcare and politicians and NHS officials. This is called the revolving door in the United States. I think it's probably known by the same here, where you have officials from government going to work for private industry and then coming back from private industry to go back into government. It's very common in areas like financial services, think of Wall Street or the City of London, but it's also extremely common in the medical healthcare industry. And I uncovered at least 4 people who've been through this revolving door here in the UK. Simon Stevens was NHS Chief Executive until 2021. And before that, he was Vice President of United Healthcare from 2004 to 13. And while he was at United Healthcare, he founded a lobby group called the Alliance for Healthcare Competitiveness to basically force state-run health systems like the National Health Service to employ private U.S. health firms. Another guy named Nick Seddon was UK Special Advisor from Health from 2013 to 2016, and he left to become Executive Vice President of Optum, and there was no vetting for conflict of interest when he left. There was a guy named David Sharp, who was NHS England's Director of Commissioning Operation for the Central Midlands until 2015, when he left to join, you got it, Optum, as Senior Vice President for Growth Strategy in the UK. And then you had former GP Martin McShane, who was a Director for Long-Term Conditions and Mental Health in the NHS from 2012 to 15, and he joined Optum as their Chief Medical Officer. Now, Health Secretary Wes Streeting has been showered with money from private health interests. In fact, more than 60% of the registered donations that he's received have come from private healthcare interests. These people are expecting a return on their investment, and so far, Streeting is delivering. Now, if Scotland is going to save its National Health Service from the privatisation vultures and America's fate, then it has no option but to step up and end the failing union. Okay, the third topic I want to address is the Chancellor Rachel Reeves' decision to call in private sector bankers to advise UK government on where it should be making across-the-board 5% cuts to all departments, all government spending departments, and why this is not a great idea. She's setting up what are called challenge panels, staffed with people from the banking sector and other private sector business people to help the government find what she calls efficiency savings, which is another word for spending cuts. She's even channeling her inner Margaret Thatcher by saying she's going to wield an iron fist against government waste. And this, I think, implies that all government spending is wasteful, it's not productive, it's not efficient, whereas the private sector knows how to realize efficiencies, and everything that it does is going to be useful and productive. Nothing could be further from the truth. The fact she's calling in the banking sector to advise her says it all. These are the people who blew up the UK economy, in fact the world economy, in 2008, and have done on numerous occasions, and have required massive bailouts from governments across the Western world to extricate them from the messes that they created. So these are the last people in the world the UK government should be taking advice from. The city claims that it adds value to the UK economy to the tune of £97 billion a year, but that's just 3.8% of the total UK GDP of £2.54 trillion. And it employs 678,000 people. They're young, highly skilled, highly paid. and half of them are from outside the UK, interestingly. But if they were employed not in the City of London, but in actual productive sectors of the economy, like education, like healthcare, like engineering, construction, the arts, a number of things, would the UK as a whole be better off as a society? You bet it would. But let's not kid ourselves. That's not going to happen anytime soon, because the system is such that the reason our politicians prioritize the financial capitalists, the leeches on the body of the UK economy, who are extracting value, not adding any value to it, the reason they prioritize them is because they're getting their funding. They are part of that system. They are funded by these people, and they know that they will join them when they leave office. It's, again, part of the revolving door. So you have to actually break that system. And the best way for Scotland to break that system is to break out of the UK and establish a fairer system of governments where the people are actually making the decisions and not these giant corporations which have basically taken over the UK government.